Well, Katy got where she is today really because she has secondary progressive MS, and obviously that's deteriorated over time. And I think perhaps in the last 4 years we've really needed the care. Katy has always wanted to be cared for at home, and I've always wanted to be with her. Before we had the personal health budget, for a short period of time we had care provided by an agency. We first heard about the personal health budget from Continuing Care, who were providing the care at the time, and it seemed a good opportunity. It took a fair amount of time to set up, but not too long. We were given a lot of help by Edge UK, and they were very, very good. I have to say it helps if you have access to the internet and if you are able to do some things yourself, but certainly all the information was provided. Important things like contracts of employment, insurance, a lot of information was made available which enabled us to put this in place. Since getting the personal health budget, we have been able to employ our own personal assistant, and also we have a relationship with another care agency, and we feel that we've been in control and things have worked out much better. With that money, I'm able to pay the personal assistant, the care agency, and obviously I am an employer, so there are tax liabilities, but all of that is calculated in our case by A4E, who do the accounts. We just tell them how many hours have been worked and by whom, and then they send me a pay slip, and then I'm able to, from the bank account, pay the personal assistant and the Inland Revenue and the care agency, whoever. There is more work on our part, but it is definitely worth it. The main benefits of employing your own personal assistant are that you see the same person all the time. You've got that continuing element. The personal assistant knows the patient very, very well, and you can trust the person a lot more. They're far more likely to pick up on changes in the illness, whereas different people coming in all the time from agencies, there's always constant training needed, and you don't know from one day to the next who you're going to get. So the benefits are definitely there. The respite care side of things has been very good because in our case our personal assistant has actually moved in when I've been away. It's been much better for Katy because she's had the same routine. She hasn't been taken anywhere else, and I have felt that it's been a lot better all round. When I'm away, I totally trust the carers that we've got, and I'm able to relax and enjoy the time off. We have a backup plan. We have a good relationship with a care agency. They come once a week usually to provide some help when our personal assistant isn't able to. And that really provides us with a backup plan in case of illness or holidays. One of the problems we had with the care agency was that they were responsible for getting Katy up in the morning, and unfortunately the time at which they arrived seemed to get later and later, and some days she wasn't being showered until about 10:30, 11 o'clock in the morning. And we feel now that with our own personal assistant, obviously we can control the timing and everything a lot better. We also found that care agencies tend to be very task orientated, and there wasn't really enough time to spend with Katy. They came, they did a job which was fine, that's what they were paid to do, but there wasn't the social interaction that there is when you have a personal assistant who's here a little bit longer. Since receiving the personal health budget, I think it's given us much more control, and the care is far more consistent. And I think overall the benefits to Katy have been huge, and it's certainly helped me manage the situation, and I think we're all a lot better off as a result.